And that will bring us to the reopening agenda item 8, because in the beginning, after the lunch, I reminded you that we have some unfinished business still from yesterday, and this is one of them: European Programme of Work 2020-2025, United Action for Better Health in Europe, monitoring implementation. We heard yesterday from the regional director about the importance of measuring our progress on achieving the objectives set in the EPW. We heard from Dr. Natasha Azzopardi-Muscat how this monitoring framework was developed and how it would be set in motion. But we still need to hear from you. So first we will look at the pre-established list of speakers to be followed by international partners and non-state actors. I will invite any other delegation still wishing to intervene on this item to raise their hands now, as I will close then after the list for a while. So now I have on speakers list 4 delegates. I have Russian Federation, Ukraine, Israel and Netherlands. So if you would like to then make an intervention, please raise your hand on the Zoom platform, and after we have then had these four interventions, I will look if there are any other delegates willing to give your intervention, and then we go to the NSAs and the replies of then and comments from the discussion. So now I will give the floor first to Russian Federation, followed by Ukraine and Israel. So Russian Federation, the floor is yours. I think we are not connected with the Russian Federation here now. Do we have Ukraine? Is Ukraine ready to do your intervention? Do we have? No. Israel? Is Israel available? This goes quick. Netherlands, next.
Hi, this is Mark from Boston, Netherlands.
Nice to hear you. Go on.
It's good to see you. Dear Chair, Regional Director and dear colleagues, the Netherlands would like to thank the WHO Regional Office for Europe for the clear document on the European Programme of Work Measurements Framework. We recognise the framework's importance in underpinning health policies and moving health forward in the European region. And as a long-standing supporter of the WHO European Health Information Initiative, we regard the framework as a renewed opportunity for collaboration in the field of health information. We embrace the fact that the framework is building on the SDGs and existing international indicators and intends to work towards achieving harmonization of data requirements with other relevant international bodies. And we emphasize the importance of good collaboration between WHO, the European Commission, and the OECD to enhance clarity and quality of health information in the European region and to find synergies and reduce fragmentation. With respect to the framework's development list, we agree that this work needs to be embedded in the regular structures and process of WHO Europe to ensure its sustainability. And we look forward to a proposed draft resolution and look forward to continuing our work together. Thank you very much.
Thank you. We just checked that would those interventions be recorded, but they actually are the ones which we would like to have on live here. No recorded. So if I would like to call Russian Federation, if you are there and willing to make your intervention. I see Israel there. No, okay, Israel is not willing to have, but Ukraine. Ukraine? No. Okay, then we have finished the list of delegates here, and I don't have here any requests from international organizations or partners, but I have two NSA's joint statements here, as you can see, and I would like to give floor for them. So who would then give the first NSI intervention? Finnish Association for Substance Abuse Prevention, European Public Health Alliance, Eurocare, Movendi, Norwegian Cancer Society. Is someone there online connected? Please go ahead. Sorry, we can't hear you. But please, microphone on.
Hello, this is the Thalassemia International Federation. It's the second statement on behalf of IAPO and WFH. Thank you, Madam Chair. Thank you, distinguished delegates, ladies and gentlemen. The International Alliance of Patients Organizations, the Thalassemia International Federation, and the World Federation of Hemophilia work to safeguard the patients' rights and interests in all aspects of healthcare and across the world. Through this statement, we would like to take note of the progress achieved regarding the implementation of the WHO Europe resolution on people-centered health services and universal health coverage, stressing that the European Programme of Work 2020-2025 needs to encompass the principles of the WHO Global Patient Safety Action Plan 2021-2030, adopted by the WHO Europe member states at the 74th World Health Assembly. This evidence-based plan is geared towards the elimination of avoidable harm in healthcare and is very timely given the need to restore trust and compassion in our national health systems, which have been severely hit by the COVID-19 pandemic. The pandemic has hindered progress towards universal health coverage and the 2030 Agenda for Sustainable Development, and prolonged the suffering of those patients with non-communicable diseases, including people with chronic, complex diseases and other birth defects who do not have access to essential medicines, treatment and care. Our respective communities that include people with inherited hemoglobin and bleeding disorders, such as thalassemia, sickle cell disease, hemophilia, and von Willebrand disease, have reported disrupted access to treatment in many countries of the region, raising the alarm for blood shortages and limited access to prophylactic therapy. We thus strongly support the patient's uninterrupted access to treatment and patient safety at all times. The European Programme of Work is a live document, easily adaptable to needs, trends, and challenges. It thus needs to serve as a tool for member states to take a decisive step towards patient safety in all policies. We thus invite member states to remain firm to their patient safety commitments and promote policies which are aligned to the Global Patient Safety Action Plan. Finally, we take this opportunity to ask European member states to observe the WHO World Patient Safety Day on the 17th of September by lighting their respective national monuments in orange. Thank you, Madam Chair. Thank you, delegates, for your attention.
Thank you. I now have informed that Russian Federation is ready to give their intervention. Come back to delegates list. Russian Federation, the floor is yours.
Уважаемый председатель,
Distinguished Chair, the delegation of the Russian Federation has
closely studied the presented document and wants to note the large volume of planned work based on experimental data as well as the experience of countries in using various approaches to objectivize the evaluation of the impact of the activity of the WHO and their healthcare systems. We believe that the Secretariat has rightly chosen to base this monitoring system on data about national healthcare systems. When it comes to concrete mechanisms of monitoring, there are selected the goals and targets of the SDGs, which have already been agreed upon earlier as part of the 12 overall programs of WHO. So out of the 46 indicators, 13 of them in the general program of work applied to the European program of work. However, only 18 of them are proposed in this document. The additional indicators would imply more work for the members of the WHO. Could adapt these indicators to the specific circumstances of the European region with a focus on eliminating inequality and focusing efforts on eliminating the burden caused by the COVID-19 pandemic. We're interested in taking active part in this work. The Russian Federation also has noted with satisfaction the work of the European Office on Harmonization of work with international partners by creating a united integrated information system for the European region in order to avoid additional burden on the member states. We support this draft resolution. Thank you.
Thank you, Russian Federation. I now call again if there is someone connected from Eurocare to deliver then the other NSA intervention. If not, I would then go to the replies. As there have been a number of comments yesterday and today made and specific questions raised in the intervention, I will now ask the regional director if she may wish to take the floor. So, Dr. Kluge, you have the floor.
Thank you. Thank you very much, Madam Executive President. Let me start by saying that better measurement leads to better management. So it is not an option to not strengthen data and information systems. During these 3 days, throughout all the agenda items addressed, many of us expressed a desire for better data and data sharing, which is, remember, one of the main recommendations of the Monti report, including measuring who are we leaving behind. We will leave people behind if we don't know even who do we leave behind. We have to heal the fractures in society. And I'm sure that data will play a critical role in enabling our work in the coming biennium. The EPW measurement framework is our response to your request that can only be achieved if we work together, and we are committed in very close coordination with other international organizations. That's part of the plan. I would first like to express my appreciation for your kind words, in particular you mentioning that you appreciate that our EPW measurement framework is linked to the core priorities and flagship initiatives of the EPW. This was indeed our goal during development of the framework, and why we are so grateful to all the member states who provided guidance throughout its development. We would particularly like to acknowledge the kind words from the delegations which intervened for the development of the measurement framework and the European Health Information Initiative, which does not go unnoticed. And we appreciate your encouragement of our collaboration with both member states and our international organizations. I am fully committed to limiting the reporting burden, particularly in small countries. And I plan to continue enhancing our data collection clearinghouse to streamline those data collection requests. Thank you, Madam Executive President.
Thank you for those comments, Dr. Kluge. This brings us then to conclude agenda item 8, and we can now consider adoption of the proposed draft resolution contained in EUR/RC71/ConfDoc/4, draft resolution measurement framework for the European Programme of Work 2020 to 2025, or 5. 25. Yes, good. Because I have here 5 and 8 that I'm wondering. So 2025. So is committee willing to adopt the proposed draft resolution by consensus? I see no objection. So the resolution is therefore adopted. With this, I close agenda item 8.